Hi, my name is Brittany Lake. I will be discussing the healthcare delivery system for NURN 302, Business and Healthcare. The healthcare delivery system is a collaborative effort of organizations that joins together to provide medical care for individuals. It is made up of educational and research institutions, medical suppliers, insurers, payers, and claims processors to healthcare providers. This allows healthcare providers to care for patients directly. Insurance plays an important part in the healthcare delivery system for purposes of reimbursement to facilities that pay for providers and other medical staff needed. Medical suppliers are also important in healthcare so that healthcare facilities are equipped with supplies and equipment needed to properly take care of patients. Insurance coverage, cost of medical care, access, and quality of care all influence disparities in healthcare. Understanding the healthcare system helps clarify providers, healthcare settings, and purchasers. Healthcare providers are composed of physicians and non-physicians. Physicians are medical doctors. Non-physician healthcare providers include nurse practitioners, occupational therapists, physiotherapists, psychologists, registered dietitians, social workers, speech-language pathologists, just to name a few. Healthcare providers diagnose and treat patients as well as provide patient education. One disparity of healthcare is the physician shortage. There is a shortage of physicians in certain specialties and/or in rural areas, which hinders patient access to care. Rural practitioners, unlike their urban counterparts, face unique challenges such as lengthy distances between service access points, geographical or cultural isolation, resource poor, underinsured, and underserved patient populations, and lower rates of reimbursement. In an effort to reduce inequities in healthcare, technological advancements such as virtual health was created. Virtual health allows non-physician providers the ability to deliver care virtually to patients. Several studies have explored the patient and physician experience, increased quality in care, strong interpersonal engagement, high satisfaction with virtual care, shorter wait times before the encounter, and avoiding travel. There are different types of healthcare settings, such as inpatient and outpatient settings. Inpatient settings require patients to be admitted onto a unit where they are monitored for 24 hours a day. This could be an intensive care unit, telemetry unit, med-surg unit, and even a nursing home facility. Outpatient settings include emergency departments, clinical settings, as well as home health care, where patients are seen for a visit by their healthcare staff and stable enough to go home the same day. Many healthcare facilities operate on either not-for-profit or for-profit. There are inequities in healthcare access, both inpatient and outpatient. Inequities are availability, long wait times, and cost. Longer wait times in the emergency department may be due to decreased availability in clinical settings. Patients with acute illness are apt to receive quality care in clinical settings versus emergency departments. The type of setting makes a difference in the cost of health care. Compared to facilities run by not-for-profit private providers, unit costs are predicted to be lower for both outpatient and inpatient care in public facilities. These differences impact patient access and cost to medical care. Purchasers in healthcare include insurance companies, government assistance, and individuals. Medical debt is accrued for many patients with insurance as well as self-pay patients. Private insurance is purchased through employers via monthly premiums. Patients also pay co-payments for each visit and must meet a deductible set by their insurance plan. The government provides Medicare and Medicaid insurance to qualified individuals. Medicare is approved based on age, while Medicaid is approved based on income status. Patients with insurance, whether private, Medicaid, or Medicare, do not always receive quality care. For instance, studies have shown that prior authorization, which negatively impacts the ability of patients to see specialists, obtain diagnostic studies, acquire medications, and/or even start treatment, can lead to major delays in care. Individual purchasers are uninsured and pay out of pocket for their medical care needs. The Affordable Care Act was proposed to help individuals that cannot afford health insurance and has decreased the number of uninsured individuals. Some facilities may offer payment plans so that patients are not turned over into collections. To conclude, the healthcare delivery system, which is made up of providers, settings, and purchasers, contribute to the accessibility, quality, and cost of healthcare. It is important to understand how each of these components impact quality of care. The inequities of healthcare can further be resolved in access and cost with the use of non-physicians, virtual health, and affordable healthcare options.